So thanks everyone for your intro. I think we managed to go through everyone. Just in case we haven't, then please feel free to shout out. So what we thought we would do today, since we've got quite a diverse group from the different regions and jurisdictions, is to cover the first topic, which is well-being and mental. There's some interference. So basically managing the expectations and well-beings, because what we've seen in recent weeks is with the remote working, you have 1 week in, 1 week out. What we've noticed also is that in terms of your work hours, things tend to get blurred. And you have the expectation of having your employees, your own team being available to you at odd hours of the day, because you may well spend the initial bit on calls, and then when you're free, it could well be into late hours of the day. So we wanted to have a feel of how it was being done within each of your organizations, and if your clients as well have had any issues with this. Because for Malaysia, what some clients have been saying is that they've been having resistance in that context from the employees when they call them after work hours. And this is because you're not there physically. When you're there physically, things can be addressed just by going over, you sort it out. But when you're doing this remote working, it doesn't quite pan out that way. So perhaps we could hear from several of you just to see if these are issues being faced within your jurisdiction and what measures, if any, have been put in place. So from my perspective, for myself, I may well be guilty of that as well, because you spend the day with calls, and by the time the work day is over, it's 5:30 and I find, oh, I need this to be done. And I hesitate to call someone because you think, oh, am I encroaching on after hours? Is it a normal or reasonable expectation to have your associates be there for you? And on one hand, I think, yes, it's reasonable because that's the way work is. But in another sense, is this encroaching into your personal space? So if we could just hear some thoughts, Veena, perhaps if you could share if this is something live in India.
Absolutely.
Thanks. Just before, just want to be conscious of the time before I let Veena go. It is 20 after the hour. We have a couple of topics in a big group. So let's try to keep our comments, 30 to 60 seconds. And if you do want to chime in and you haven't been called on, you can use the raise hand feature down at the bottom. And just raise your hand, a little yellow hand will pop up, Sukanti and Gael, so that you can see them on the screen. Go ahead, Veena.
Sure. So yes, it is very similar. I think the days have stretched into the nights and it's become working from home and living at work. It's all the same. So this is something that was more an issue last year. Now in India, organizations have started opening up. We started having employers calling employees back to the office. And we're seeing resistance on that front. People want to continue working from home because you get to beat the traffic. You have some flexibility in terms of managing life and work. So that's something that we're seeing. One particularly interesting thing that we did see in the work from home context was managing productivity, where a lot of organizations, especially the new age ones, do not believe in time slips and do not believe in micromanaging their employees. And when the pandemic hit and when people were working remotely, people just stayed logged in for 16 to 18 hours. So, and that also could potentially trigger overtime claims and productivity issues. So it all became a slightly more complex issue. And the other thing was what we saw was very complicated and interesting instances of workplace discrimination and harassment. which happened in a remote context, and that made it all the more difficult to handle. So I'm going to leave it there, and we can pick up on any of these based on everyone's interest.
Thank you. Romina, what about the situation in Italy?
Here I am. Here in Italy, we are waiting for the government that maybe is trying to adopt some new measure to make difference between people who receive a COVID vaccination and people who not. And so we are waiting for the update about this. Actually, lots of people are still working in smart working modality. Not in the public sector, because in the public sector, it has been decided that the employees should come back to the workplaces. And so let me say, this is our update. I don't know if Stefano and Livia have other aspects to underline.
Maybe just one aspect, because now in Italy, the employer can unilaterally decide that the employee renders the working activity from home, and otherwise an agreement is compulsory. And this possibility so far can be issued until the end of December, because it's linked to the emergency of COVID-19 outbreak. On the other hand, as Romina said, there is an impulse given by the legislation to render the working activity from the working places, according to a peculiar certificate that is called the Green Pass. So you can work at working places as soon as you got the vaccine against COVID-19, or you have implemented a swab test with negative results against the infection. So this is a very peculiar case that we have here in Italy, and let's see what will be the next outcome, however, only at the beginning of the new year. This legislation only until the end of this year.
Yes,
Thank
just
you,
to
Stefano.
okay. No, just to we found also the resistance to come back to work, as the colleagues were mentioning, and in addition is under discussion to render the vaccination as compulsory. Italian government is just discussing also this topic, because as Stefano was saying, today Green Pass are a sort of a voluntary vaccination, but you are prohibited to do some activities. Instead, is under discussion to render the vaccination compulsory, just to update on this.
Thank you, Livia. Simon, what about the situation in the UK? Is it common practice now in terms of managing expectations, falling after work hours?
Yeah, it very much depends on the sector and the kind of the area people work. But there is much more expectation now that people's individual circumstances will be respected. We see a lot more practice of people using email signatures, for example, to say, these are my hours. And I think there's a lot more of understanding that people do work different hours. But that said, we are still bound by the working time regulations and business requirements. So we still see quite a few issues with clients as they're still trying to balance that out. A lot of it comes down to communication and management. There's no overarching government legislation or policy. It's all basically down to individuals and how they operate within their teams.
There's some flexibility then in terms of how you operate.
There is, yes. So, from our experience, we've got people in the team who would rather work later into the evening than early starts. And as long as we all understand where that is, and as long as client needs are met, then that works fine. I tend to work around my children, for example. So, as kind of many of us do. So people know at certain times of the day, it's best not to put calls in for me, but then I can pick things up in the evening because I'll have a break when I'm putting kids to bed. So it's, for us, I think it comes down to that communication and setting that, what leadership kind of messages come through.
Right. Thanks, Simon. And Ryan, what about within your firm itself? Is that the same practice adopted?
In Canada, yeah, it's about the same. What Simon had described, that working times are generally flexible, and people, as long as client needs are met, then people have different working times, and as long as there's good communication, then it's understood across the firm. There is legislation being drafted in Ontario specifically, that there's no preventing any employer emails or communications outside of working hours. It's still in draft and hasn't been received royal assent yet, but it's expected to pass in the next coming weeks or months. So that will be interesting to see how that impacts the effective work, and what sort of exemptions, if any, are from that working time hours.
Thanks, Brian. Does anyone present on this call, are there any jurisdictions where there is actually legislation on this in terms of, not calling after work hours or the need to maintain the statutory hours? I mean, we don't have that in Malaysia. So I'm just wondering whether anyone in any of your jurisdictions, whether this is something in the makings. Francisco, you've got your hand up.
Yes, thank you, Sugandhi. Actually, in January of this year, here in Mexico, it was enacted a labor reform for teleworking modality. And within this reform, it was included the right to disconnect from work after the work shift has concluded. So as a result, at least from a theoretical perspective, because I know that in practice it may not be the case, but the employer cannot reach out to the employees after the work shift has concluded when they are working from home. So that the idea behind that piece of legislation is to draw the line and to eliminate the possibility that it is possible to ask someone to work after hours or in the evening or actually on the weekends, since they are working from home. So that was new, and of course this is very recent. So employers are still kind of struggling to implement this, and of course there is a cultural issue as well that will take place for everyone to get used to. Thank you.
Thanks, Francisco. Santiago, then Katie.
Yes, in the case of Uruguay, it happened something similar to what Francisco was saying for Mexico. We had a new legislation approved a couple of months ago, and it expressly stated the rights of the employee to disconnect and to not be contacted by the employer. I think that it's much more, also as Francisco was saying, much more of a theoretical thing, because it's difficult to control in the facts. It raised a couple of discussion. One was if this right to disconnect applied only to remote workers or to all the employees, because in fact, I mean, generally, you can say that an employee has the right not to be contacted after or before the working hours. So this is something that is not already settled, that discussion. And the other thing was how this deals with the on-call employees, which was a regime, and maybe I guess that in much of your jurisdictions is also valid, the possibility for some employees during some period of hours to be at the disposal of the employer, receiving a payment because of this on-call, which is very usual in terms of the software industry, for example. So at least up to now, it is not clear how you can deal with both things, with the possibility of stating an on-call regime, and on the other side, the right to disconnect of the employee rights.
Thank you, Santiago. And Katie, just before we move on to the next topic.
Thanks. So I'll be very quick. So in April in Ireland, we introduced a statutory code of practice on the right to disconnect, which is kind of similar to what our colleagues were talking about there. Now, it's just a code of practice, so it's not really legally binding as such, but it's kind of the standard against which employers will be measured in the event of a claim. And it recommends that, it offers lots of recommendations as to how you should recognize people's right to disconnect. Things like email filters with their working time and not arranging meetings during working hours and that kind of, or during lunch hours, break hours. But at the same time, it does recognize, and it's helpful for employers, that there are going to be situations where you have to be contacted out of hours. So it's not very strict saying you can never contact people out of hours. It just tries to promote a balance. So I think that's quite helpful. And yeah, we're seeing a lot of employers trying to roll out kind of particular training on the right to disconnect and new policies on that, trying to encourage it. on a kind of organizational basis, but there isn't any strict claims you can bring, and it's certainly not the case that you can't email someone after 5 o'clock. We just, try to encourage you to indicate on the emails whether or not it's actually an urgent email. So that's the position in Ireland.
Thank you very much, Katie. Gail, David, perhaps you'd like to move on to the next topic we have on our agenda.
David, do you want to take the lead, or do you want me to take the lead?
I can start talking about it if you want, Gael. We can team up on it if that works for you.
Perfect.
So the other thing we wanted to talk about was COVID. Unfortunately, I think everyone, and there were some allusions to it. Our Italian friends were talking about it. It seems like the 800-pound gorilla that everyone's still got to pay attention to. And some of the stuff we're dealing with in the United States has to do with the requirement of a vaccine. There are, in the United States, I think we're a little bit unique. Maybe Canada is similar, but most of our laws come from states rather than from the federal government, with one main exception. And so there was recently an attempt by the Biden administration to mandate vaccinations for larger employers, meaning employers with more than 100 people. And there are also certain states who have said that employers cannot actually require a vaccine. It's unlawful to require a vaccine. So you've got this real inconsistency in the United States. And we were thinking that it'd be interesting to hear from folks about what's going on in your country in terms of how either the government or employers can mandate vaccines or not for the workforce. And if there are exceptions, what those exceptions are. For example, in the United States, even where vaccinations are mandated and employers can mandate them, there are two carve-outs usually. One is for people with religious objections to getting vaccinated, and the other is for people who are, it's contraindicated medically. There's a medical reason they can't get vaccinations. And it's not 100% of a defense, but in most cases, that's an exception from any vaccine requirement. So why don't we throw it to some folks to get their perspective? Laura, perhaps, do you want to provide a perspective from Spain?
Sure. Spain is a little bit like the US in this sense because we do have a general government, but regions can also change a little bit the laws. So it's unlawful in Spain to require vaccination. This is a general standard, and there's been long debates, I guess. Italy can help a little bit with what their solution was about whether being able to mandate employees to vaccinate, but it has been disregarded for the time. So this is not working right now. We are enacting regional regulations for general citizens to require the full COVID passport to get into restaurants, clubs and places where there's a lot of people. But this is just starting, and definitely not even for industries like aged care, hospitals, and so on. It's not required.
How about Melike? Did I say that right?
Yes, hi, that's me. So actually, I'm connecting from Turkey. Sorry, when I reconnected, my country is disappeared somehow. So in Turkey, actually, we also have a similar situation. The vaccination is also voluntary here, and there's a huge group of people who are anti-vaccine, I can say. So you cannot, unfortunately, force the employees to take vaccination. But as an employer, you're under obligation to provide, to seek for alternative methods to provide a safe working environment for all vaccinated and unvaccinated employees. So even if an employer decided to ask their employees to come working from the office space physically, it should still is under obligation to ask the unvaccinated employees to work remotely if possible. We also have sort of a COVID passport or green pass since the very early days of COVID. Even there was no vaccine, we had that sort of an application in our telephones, mobile phones. So and if it's only green, then you can enter the supermarkets or take the public transportation or make the travels or go to the places where the other people can also enter. But unfortunately, you cannot ask that details when you're entering to an office space. But there's an alternative to that. So the government says that the employees discretionarily may ask the employees to provide a negative test result of a PCR test, which was taken 48 hours before they enter to an office space. So this is one of the alternatives, but unfortunately, the situation is still not very much clear. But mostly the employers are, how can I say, they encourage their employees to get vaccinated if possible.
And did you say the employer cannot require it, but could ask unvaccinated folks to work from home and allow only vaccinated people in the office?
Yes, or alternatively, I mean, if the unvaccinated people has some sort of an immunity, for instance, if that person got COVID, got ill from COVID in the past 3 months, I believe. So that person is considered to have an immunity against COVID-19. So that person can also enter into the office space, or alternatively, they should provide an updated negative PCR test result to enter into the office space and to work with other colleagues.
Okay, great, thank you. Johannes, how about in Germany?
We copied a little bit the Italian way. So we have from tomorrow on, we have you call it Green Pass. In Germany, it's 3G. That stands for the 3 German words, geimpft, getestet, genesen, which means you have to be vaccinated, recovered, or tested to enter the workspace. So this will apply from tomorrow on. There is, as you said, there is no entitlement for the employer to require vaccination. So the German legislator decided not to have a obligation to vaccinate yet, and therefore the employer also does not have the right to ask for a vaccination. However, from tomorrow on, you're only allowed to enter a workplace if you are vaccinated, recovered, or tested. And at the same time, also from tomorrow on, there is an obligation to work from home, which means the employer has to offer work from home, and it's only allowed to work in the office if there are compelling operational reasons, which can be that everything which requires a presence in the office. Otherwise, the employee has to work from home. But on the other hand, the employee is entitled to say, I cannot work from home, and is not required to have a reason for that. So it's enough for employees to say, I don't want to work from home. And then the employee can still work from the office, but the employer has to offer it. So these are pretty much the 2 main regulations which will apply from tomorrow on.
So that's interesting. So an unvaccinated employee who refuses to work from home could come back to the office?
If he is tested, yes.
Okay.
But at least, so because the employer has to offer 2 tests per week to the employee. So if the employee is working 5 days a week, at least 3 tests has to be organized and paid from the employee himself or herself. So the hope is that this will lead to the result that a lot of people will get their vaccination now, because otherwise you have to pay for 3 tests a week.
Mark, how about the Philippines? What's going on there with vaccinations?
Oh, in the Philippines, we will have a new rule by December 1. So either the employee gets vaccinated, or they should present test results showing that they are negative for COVID-19. So if you will not get vaccinated, or if you do not present this negative test result, then the employer can refuse to allow you to report to work. So if that happens, then the no work, no pay rule will apply. So that hopefully will encourage everyone to get themselves vaccinated.
Does anyone live in a country or a part of a country where either the government can require the vaccination of everyone, maybe subject to exceptions, or that an employer can say, hey, look, if you want to work here, you have to be vaccinated?
David?
Yeah.
Yeah, hello, here's Mikio. I don't know how to put my hands off. So, yeah, so, well, although I'm very surprised to learn these new developments in other jurisdictions. In our country, it's very fuzzy. There is no law which obliges to take the vaccines. And there is no law to put masks. Everything is fuzzy in our country. But at the worst time, before around the Tokyo Olympic, there were 25,000 new cases per day in whole Japan. Now, well, yesterday, it was 150 new cases in whole Japan. And so therefore now it's so quiet, but of course the things may go worse very quickly. But though somehow this works without any law, because we are such a scary people. We are afraid of against the pandemic. So if you see the streets in Japan, I would say 95% of people walking on the street wear masks, although there is no law for that. And everybody is crazy to get vaccinated, although they are not obliged to do so. So the rules in Japan is very fuzzy, but somehow it works. So it is very well. Although the difference in the system is so different.
That's interesting. So the government is fuzzy. Does the employer play any role, or is it real in terms of requiring? It's all from the employees, from the individual.
Well, there is a discussion whether it is legal to oblige the employee to take vaccines or to wear masks in the office. But so in most of the companies, there is no such internal rules. But the people take vaccines. But the people wear masks even in the buildings. So that's the situation in Japan.
Is the vaccine rate very high there? The vaccination rate?
So about 70%. Japan's our government is very slow. Right? In Japan, the vaccination started in February this year. So it was very slow, but now but I think the situation is very similar in many countries. The vaccination rate increases, but it stops somewhere at around 70. Right? That's my impression, and we have also reached this percentage.
Okay. Thank you, Simon. You have your hand up. Did you have something to?
Yep. So in the UK, the least I say about the government's fuzzy response is probably the better. But we have mandatory vaccinations required for people who work in care homes, so homes where the elderly or kind of people with medical needs. That came in last week, I think. So if you are entering a care home, you have to have a vaccine, and that's if you're a kind of an employee or indeed a visitor. There's exemptions if you have medical conditions, and also if it's for an emergency. But that's one where the government has made legislation that requires people to be vaccinated. And there's from April next year, anyone who works in the NHS, in a particular anyone who's in a regulated environment in the NHS who is patient facing will have to have a vaccination as well. Again, with kind of various exemptions, medical health reasons. But so that they're the only two places where the government has mandated vaccines. Quite controversial, but they are kind of being pushed through. We do have a number of controversial employers who like to make statements that no jab, no job, and things like that. There is no legal right for them to say that. So you can't force anyone to have a vaccine in the UK, but you can kind of have it as a rule, if you like, and then kind of manage it. But if somebody isn't vaccinated, you can't refuse them to come for work unless you've got kind of manifestly health and safety reasons, etc. Where it does come in here is if you come into contact with someone who has COVID through our track and tracing, if you're not vaccinated, you will then have to self-isolate. If you're vaccinated, you don't have to self-isolate. So then that causes a problem at work if you're self-isolating, and we fall back into what we had in the pandemic about whether that then is kind of unpaid leave or leave. And that's very complicated, and I'll go over my 30 seconds, but so I'll leave it at that.
And just one quick follow-up, Simon. Can I know an employer, you said an employer can't require vaccination, but can an employer say, well, you have to either be vaccinated or tested or wear a mask or social distance, something like that, take alternative measures?
Yes, you can. In the UK, you can pretty much tell anyone to do anything, whether or not they have to then abide by it is kind of different. But yeah, we have the social distancing rules, wearing masks, people can do. But then if you have people who refuse, it's then difficult about what you then do with them, because you then have to have a valid reason to then discipline, etc. So it kind of becomes, it's almost like the so what. So that's why we have a lot of, and it's not helped by the government guidelines, which don't make it obligatory. Because if the government guidelines did, then we would be able to do that as well. So there's a lot of kind of trust, if you like, and to be, people aren't wearing masks much in the UK now. And social distancing seems to be disappearing as well.
Okay. Thank you. Gael, you had your hand up for a little bit. I don't know if you wanted to contribute on this.
Yes, but briefly, just to mention, in Belgium, they have a new regulation. And since 1st January, it will be compulsory to be vaccinated in order to work into an hospital or a care home. And if you don't get the vaccine within the 3 months starting from 1st January, the employer is authorized to put you on an unemployment. And after 3 months of unemployment, the employer is entitled to terminate the employment contract. So it's a quite good incentive in order to have people to get the vaccine.
Great. Anyone else? I mean, we've been around to a few different people, but anyone else have anything kind of different? I mean, Carol, I know you're geographically close to Mikio. Mikio seemed like kind of a little bit of an outlier in Japan, although it seems to be working. How about in China? Do you have something similar?
Yeah, China is very much similar like Japan. At the beginning, a lot of community leaders would encourage people to take a vaccine, giving people some gifts like iPhone, or give them gifts like a bottle of food oil, or small gifts to encourage people. But actually, our situation is very much like Japan, that government just encourage people, but I think our people also very much fear of being affected. So, families, members, and colleagues are encouraged with each other to take vaccine. So, so far, I think almost all people in China, except certain people who cannot take vaccine because of illness or health condition, I think most of people has taken the vaccine. And also, like in Japan, that people take masks all the time when they are walking out of their house. So currently, when we get into the office, that the office security will check our green code, because everybody can have a green code in their cell phone, because in China, that if this city has no infected cases, then the government will make people's cell phone connected with the with the data that the city is free of infection, so that your cell phone can show that this is you are from a safe place. So your phone has a green code. And so when we get into the office building, that we need to wear masks and show the green code and have the temperature tested. So so far that we still have some cities have small infection cases, but most of the cities are quite safe. So this is the same situation, very similar like in Japan.
Great.
I'm sorry. The situation is completely different because in China the control is very strict, but in Japan there is no governmental control, almost nothing.
Oh, it's true that if one of the area if infection cases are found in the cities, then these cities will be locked down, and also people cannot leave their house or cannot leave their house freely. So there will be lockdowns. So in this way that and immediately their green code disappeared, and on their phone that there will be red code or yellow code. So if the city or this place or this district found infected cases, then immediately this area people their travel code also become yellow or become red. So in this way that people cannot take public transportation or cannot get into the public buildings. So because of this, that it is true that the government control is very serious, but because the infection in our city and in China are not so much. So for us, we still feel quite freely to walk everywhere.
Katie, you had your hand up for a little bit. Did you have something to add for Ireland?
Yeah, I'll just be very quick because I'm conscious of time for everyone. Vaccines aren't mandatory in Ireland, but interestingly, from a data protection perspective, our data protection commissioner has said employers shouldn't process any employee vaccine data whatsoever. So that means other than in exceptional circumstances, so for example, healthcare, employers can not only not require employees to have the vaccine, they can't ask employees whether or not they're vaccinated, they can't process any employee vaccine information, even if the employees voluntarily give that information to the employer. So that's really difficult for employers. It puts them in a very difficult position in terms of coming up with health and safety protection measures. But that's the view of our data protection commissioner. So that's an interesting one.
It's really interesting. I mean, you can really see from different countries. I mean, there's a government who maybe is hands-on or not hands-on, as the case may be, and there's a wide disparity there. But also from an employer perspective, I mean, it sounds like in Ireland that the employer really can't do anything, is actually has to be almost vaccine neutral. Whereas I think in other
vaccine neutral, yeah.
Yeah, I mean, in other countries, I'm just looking at Brian's comment in Canada, in the US. I mean, I think in large part governments are saying, hey, look, it's your workplace. If you want to require vaccines to come into your workplace, you have the right to do that, subject to certain exceptions. Although that seems like the minority view. It seems like most people do not, most countries do not empower employers to make those calls, like in maybe North America. Anyone else have any? I know I want to be conscious of time as well, and we've got a few minutes left. Anyone else want to add anything, or Gail or Sugandhi, do you want to wrap up if no one else has comments, or Hannah?
Yeah, I think we'll need to break out to the rooms for the last few minutes for the speed networking. I think Hannah's going to break us up.
I know we're.
Do we still have
we're
time
right
for that?
up. We've got about 5 minutes. If folks want to stick around, I can do some breakout rooms for 10 or 15 minutes, but I know that we're just a couple of minutes before the hour. And we can also, Sugandhi, we could also try to schedule one for January where it's, you know, 20 minutes of conversation, and then we can do a couple of lightning rounds of speed networking for folks. I do plan to circulate a recording of this meeting along with a list of all the folks who have attended and email addresses. So if you wanted to follow up or continue, I see a lot of you have been chatting in the chat feature, which is great. But if you wanted to continue the discussion on email, you can certainly do so.
And it will be great if you can update the list of the member of this group, because and we know that we have a new attendees for this call. So if you can just update it and like that, we have a full picture of the attendees.
I will do that. And you can find members of the group. And for anyone who is new today, I'll make sure that you're added to the group list in case you have not done that already. Once you have created the profile on the website, which I know a lot of you have done, you can go to our committees and groups tab and select the HR committee. And then on the right-hand side, if you scroll down below the practice group leaders information, you'll see a little members button where you can find other members of this group. I will say that in January, we are updating our website, and we will have an all member directory so that you'll find anyone within the network and you'll just be able to search by the group. It'll be a lot easier to find folks, but that will be coming in January, and you guys will be hearing more about that from us in the next month or so.